mind-boggling to me.
Karen Hill runs a health clinic providing basic screenings and preventative care for the homeless, uninsured, and underinsured in San Francisco.
I think that health care certainly is not a privilege. It's really, a right.
She says she supports President Obama's Affordable Care Act, which she says will benefit all Americans.
We're all in this together. We're all shopping in the same stores. We're all riding the same public transportation. We're on the same planes. So if you have somebody who can't ever get a TB test, who is maybe walking around with a pneumonia or something that nobody can diagnose because guess what? They don't have the money for, $1,000 or $2,000 emergency room bill. Then all of us are at risk. It's a public health issue.
By January of 2014, the law requires nearly all Americans to be insured. It'll greatly expand Medicaid for the poor, help low and middle income earners pay for coverage, and ensure those with pre-existing conditions aren't turned down. Add all that up, and many of the 50 million previously uninsured people turn into new patients for a medical system already taxed by high costs and a shortage of primary care doctors. The law attempts to help providers care for the influx by opening new health clinics in underserved areas, providing incentives for med students to go into primary care, and creating so-called accountable care organizations to try and control costs.
It's going to put providers more in kind of HMO sort of organizations where they're going to have to more systematically meet and discuss the kinds of treatments that they provide, sort of care that they give. They're going to have to become a lot more reflective about what they do, whereas right now with sort of your Wild West medicine, most physicians do whatever they feel like doing at any particular point in time. I mean, they're exercising their best medical judgment, but oftentimes without the benefit of any extended and serious discussion.
For primary care doctors,
there's going to be some forgiveness of loans, some supplements for people going to medical school who are going to become primary care physicians. How well that's going to work out, we're not clear yet.
Tom Pites is on the front lines of the healthcare reform debate, running an emergency room which has to treat anyone who walks in the door.
That is not an efficient or an effective use of resources. But because of the way the system's currently structured, that's all they have.
He says the healthcare system needs reform, but worries the president's plan will only create more bureaucracy and confusion.
But I really say, where's the leadership on this? They came out, they passed this law 2 years ago, but it really hasn't been implemented. And I don't think anybody really knows how it's going to impact healthcare. And I think that creates a tremendous amount of anxiety, a tremendous amount of distrust.
Some oppose insurance mandates since the government, and not doctors and their patients, in part will determine some coverage options for Americans.
And if they direct that money towards areas that really don't provide a lot of care, I think it's going to fail.
Hill says she believes some opponents of the president's plan simply don't care about the less fortunate.
There's some folks in the government who don't think that health care is important, that everybody should be able to figure this out on their own. And that if you can't figure it out on your own, then maybe you shouldn't even be able to live.
The U.S. Supreme Court is set to hear arguments on healthcare overhaul next week. Haven Daily, Associated Press, San Francisco.